Selected conditions. This is quite possibly the best chapter to use to review the entire course. So let's get started. Read this chapter in its entirety, okay? And then, if you need help clarifying something, go to the chapter that actually reviews the topic. So purge, postmortem evacuation of any substance from an external orifice as a result of pressure. Condition can occur prior to, during, after embalming, and purge is always described from where it came from. Several sources, gas, decomp, or even true tissue gas, pharyngeals is the causative agent, distension. That means your guts are actually bloating up because of the stuff that's inside, and then also edema, ascites and hydrothorax. What will predispose you to purge? Decomp, lung delays, abdominal, thoracic, or cranial surgery, tissue gas, go figure, hydrothorax or ascites, which was in the last slide, peritonitis or bloodstream infections, because your body's going to try to dilute the stuff. And then esophageal varices, ulcerations of the GI tract, or internal hemorrhages. Again, your body trying to do something to keep water in, and it just flows and causes you to swell. So protect against purge with application of massage cream around the orifices. That way nothing that comes out stains anything. Light coat needed because you end up washing it off in terminal disinfection anyways. Proper packing following embalming is going to be necessary. Kind of a no-brainer. Remember, it has to have a pressure and it has to have something to purge. If you're missing one, it just ain't going to happen. Go ahead, review the chart to remind you what's what. Stomach, coffee grounds, lung, bright red and frothy. Esophageal varices, bloody liquid, it kind of is what it is. If you can't determine, where the anus is, you need more help than I can give you at this point. Kind of common sense. Rarely does anal purge contain arterial solution, but if you have a hole that goes straight through you, you'll inevitably get it. It is rare. Ulcerative colitis is usually the problem with it. Post-embalming purge is your biggest problem because that's not going to stop by itself. You have to do something. So reaspiration, re-injection, repacking would probably be necessary. You can even remove the trocar butt and let some of the gases escape and then cork it back up again later. But realistically, reaspiration and re-injection of cavity fluid is going to be a gimme. It beats it to death, reaspirate, repack, and re-inject. And don't forget, in an autopsy case, you can actually tie off the rectum. From the inside of the body, you can tie off the esophagus and trachea so nothing backs out of the mouth. You can go south, obviously, in the same method. 5 types of gases, subcutaneous emphysema, you inflating someone with an embalming machine, gas, gangrene, tissue, dead gas, and decomp. And this chart is amazing. This should be Quizleted. This should be on your note cards. You should have this down. This is how you memorize this stuff. What it is, where you find it, what the characteristics are, and what the treatment. It does not get any easier than this. Source of gas is usually in a dependent part of the body. Gas rises. It goes towards the top. So if you're seeing it and the body's at an angle, it's in the chest, chances are whatever's causing it is somewhere south of that. Okay? Detected one of 3 ways: distension or swelling, distension of veins, so the marbling, or you can actually feel it crackling underneath the skin. It feels like cellophane. Subcutaneous emphysema, okay? Subcutaneous emphysema is not caused by bacteria. It's usually as a result of someone cracking a lung and then forcing air into the tissues, or you inflating someone with the embalming machine. It's usually the one we have to deal with because it's part of the heroics when a person is dying. And it's best just to play with that after embalming. And it gives you the causes right there. Tracheotomy surgery, stuff like this. Look at the ones that you don't know off the top of your head. That's what's important. Machines technically will shut themselves off. They hear that siren go off and away it goes. But if you got one of the older ones, you may have a situation where it will just pump and pump and pump whether it's got water or not. That is very rare. So just be aware that if you have an older machine, you should pay attention when it runs out of fluid. You don't know if it auto shuts off. It's simple. Turn the machine on, drain it into a sink, and when all the water is gone, if the buzzer never goes off, it will not shut itself off. More than likely to be used with a pressure machine or hand pump because it is what it is. Eyelids are one of the first areas to distend as a result of gas. That would be important. Even if it's just a small amount, the air is probably going to push them up. Gas gangrene, this is where it talks about this in quite specific terms. You can see that it's pretty nasty. Okay, it's pretty nasty. It causes local tissue damage and then will work its way throughout the body. As soon as the bacteria enter the blood just before death, you're kind of pretty much screwed. Spread is very rapid. Gas gangrene usually occurs after severe farm or vehicle accidents, close-range shotgun discharges where the wound may be contaminated with something, and compound fractures. So basically, it needs a source to get in. It just doesn't magically happen. It begins at the margins of the wound, goes through a color change. Okay, that would be important. Dark red, green, black. Considerable swelling. Smells like hell. You really can't miss it. Blisters, skin slip, foul odor. I mean, this has all the indicators of making your life absolutely phenomenally miserable. You'll even crackle when you touch it. The big thing is if death occurs shortly after injury, you might not even know that this is happening. So you can come 0 to bloated in like 2 or 3 hours, and it's done because it's an internal problem. You would not know it. If embalming is not sufficient to control it, it's going to go crazy. And it also jumps bodies. So if you don't decontaminate your tools appropriately, you gave it to the next client as well. That is hugely problematic for you in regards to lawsuits. Tissue gas is basically an extent of gas gangrene, okay? After death, it results from the contamination. I've already talked about how it jumps. They're resistant to disinfectant. You really got to make sure that you're doing what you're supposed to do and the disinfectant is fresh. Gas is larger in volume than liquid it displaces, thus tears and distends the tissue. You can even, eyelids, neck, scrotum of the male, problematic. Here are the conditions predisposing to tissue gas. I would know those, okay? And look what that second to last one is, unsatisfactory embalming. That means your job right. And then contact with contaminated instruments. You didn't clean your tools right. Decomp has been beaten into. It has its own chapter. I'd go back and look at it. Embalming protocols, you should be able to kind of figure most of this stuff out on your own by now. If you have a complication, you're looking at least isolating the head with restricted cervical, going section by section, slightly stronger solutions, 2% plus, special purpose or higher index, and use of proper co-injections. Let's see, I'll keep on going. Preparation should be started as soon as humanly possible. The quicker we get the body, the better results. If the gas source is an extremity or in an area such as the buttocks, you can make a barrier of underlying cavity fluid in addition to sectional embalming. That would be something new that we haven't seen before. Okay. Be familiar with the following treatments. Channeling. Okay. Is basically the big thing here. Removal of gas from tissues. Channeling. Removal of gas using a half-moon incision at the base of the neck. Also channeling. Removal of gas from eyelids and orbital areas. Very carefully. And they recommend the use of a bistri knife or a hypodermic needle. And removal of gas from facial tissues, which again is more channeling, that they simply want to try to extend into something else. Be sure to look at the treatment for lips channel from the inside so that leakage will go down the throat. So if you're going to be carving away at the lips, do it from inside the oral orifice so that it purges basically into the back. Disinfection, wash stuff. Make sure it's clean before it goes in the disinfection tray, then soak them for an appropriate time. If it's disposable, chuck the disposable stuff where it goes, and sharps go in a sharps container. Chapter 3 has disinfectant recommendations for trocar and suture needles. Basically, length of PVC piping filled with whatever that fit the trocar, and sponges soaked in disinfectant for suture needles. Cork does not work. Do not use cork to store your needles. OSHA will have a field day with you. Facial trauma. Preservation is the best you can do with the minimal amount of swelling. Easier said than done, right? Traumatic injuries can vary greatly. However, you basically have two categories. Skin is broken, skin is not broken. Know which ones fall into that. Memorize one, the other one should, kind of fix itself. Instant tissue fixation, restricted cervical, blah, blah, blah. Nothing should be new here. You treat it like any type of problem where you're going to have swelling in the head. So draining from the internal jugular, etc. Renal failure, up to 6 times more preservative is needed to preserve dead tissues that have renal failure problems. So if you had your 3 bottles before, you're going to have to up that considerably. If it's 2%, you're probably going to go to 12% to 15% solution, no questions asked. So signs of renal failure: sallow color, urochrome buildup. It's not just yellow yellow because it's jaundice. Uremic pruritus, scratch marks. Because of the buildup of the urea in the blood, you start scratching yourself all over because it's storing it wherever it can. Acidosis, GI bleeding, all sorts of good stuff. Again, we've already beat this one to death. We've talked about renal failure in other chapters and complications, so let's not, hurt it too much. Alcoholism, that's hepatic failure, jaundice, edema. Primary goal is good preservation. We don't care about the color. We can fix the color with opaque cosmetic. It sucks, but sometimes that's what you have to do. Moderate to strong preservative, medium to high index is what it's saying, even if jaundice is present. Do not fall into the trap that if they just give you a jaundice condition, you do not immediately start reaching for the high index. If it's just jaundice with nothing else, a theoretical case, you can use a jaundice chemical. And then treat bruising as you've learned in previous chapters, channeling, bleaching agents, etc. Obesity, it's really positioning is an issue. Raise the shoulders as high as possible. Get all that water out of the upper area. Again, this should not be something new to you. Head should be the highest point on the table, and then the chest and abdomen. So we should have them at an angle. Keep elbows close to the side as possible. You might have to tie them down with straps. Moving using sheeting is important. If you're going to be moving bodies, even if they're not obese, onto having that stainless steel wet is usually good. Because the neck is short, keep the head straight together. When in the casket, tilt the head slightly to the right. You can try to do this on the table, but realistically, take what you can get. Restricted cervical is a given. You do not want to play around for a femoral on a fat person. Remember, you should probably, if you're going to go for anything, should be going for iliacs. Drainage forceps, angular forceps are preferred over drain tubes. And if the obese person was also diabetic, begin embalming with arms lowered over the sides. Let gravity help you. And then if you see distribution happening, then bring them up and over. Body's going to demand large volumes. That does not mean higher percentage or index. It just means more person, more preservative. So instead of just 3 gallons, you might have to do 6. Embalmers prefer to increase the strength of solution towards the conclusion before the face are injected, just to kind of up it a little bit. If legs must be injected, make sure you use that external iliac artery at the level of the inguinal ligament. Pretty much that's right over the bone. You want it at its highest point. Purge is always a problem, the viscera. Just be aware of that. Fungus sucks. Fungi might be saprophytic or parasitic, obtain nourishment from dead or from a living organism. Know the difference. We beat that into you, I believe, in microbiology, FSC 2106 or MCB 2010. Fungal infections are not rare in humans, frequently very serious. Skin and mucous membranes are affected by fungal infections. Athlete's foot, thrush are common ones. And the more destructive parasitic fungi produce widespread chronic lesions. Fun stuff. And usually, if you're getting a fungal infection, it's because you have a compromised immune system, which also leads to the excitement and fun of what you're doing. Candidiasis or monoliasis, typically found in the mouth, gastrointestinal tract, vagina. Candida albicans is the most common cause of candidiasis. A common form of this disease, known as thrush of the oral mucosa in the pharynx, and is seen usually in premature infants and children because of their immune system not being where they're at. White patches form on the mucosa. Lesions comprise an overgrowth of yeast cells, blah, blah, blah. Similar lesions occur on other mucosal areas, which we've already seen about. Know that women on birth control are at risk for candidiasis. That's important. The skin, especially where the skin is in moist areas, groin area, blah, 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 may also be affected by this. Could produce lesions on nails, on onychia, or parenchyma around the nails. Know the difference between the two. Memorize one. The other one will take care of itself. And there's all sorts of little different subflavors of this depending on what gets affected. Gives you an idea of what the lesions look like. There's some candidiasis going on in the oral mucosa. Oral pharyngeal candidiasis is a specific complication of AIDS. That is important. This one specific one, oropharyngeal candidiasis, is a specific complication of AIDS. Aspergillosis, another fungus. Usually they're harmless, no one cares, but it will take advantage if it can. The lung appears the most common site of serious infection, and it gives you some interesting items that can happen if you get this stuff. Primary fatal disseminated infection is relatively uncommon. These are usually a secondary thing, and it shows you what a aspergillosis lesion might look like. Fico mycosis, infection of the lungs, ears, and nervous system, may display an intense necrotizing and superlative inflammation process. Fancy way of saying it kills the tissue quick and it causes you to swell like nothing else, as this poor gentleman has found out. Although this infection is commonly called mucormycosis, it can be several different phycomycetes. Mucor, Rhizopus, Obsidia. Yes, you do need to know those. If he mentions a name, chances are it's a valid question. They can cause thrombosis and infarction, basically throwing a clot, having a heart attack. They get in the blood, they thicken you up. You see these basically in anyone with a compromised immune system, diabetes, leukemia, AIDS, blah, blah, blah. Notice that antibiotics, corticosteroids from the last chapter, the stuff that, kills your immune system, boom. Histoplasmosis, also known as reticuloendothelial cytomycosis. Say that 5 times and do a shot after every one. Histoplasmosis caused by the oval yeast-like organism Histoplasma capsulatum. Pretty much Mississippi is known for this stuff. Mississippi is known for lots of things. Positive diagnosis depends on ID of the organisms and cultures. They just don't wave a magic wand and say, oh, it's histoplasmosis. It's not generally spread between individuals. You usually get it from playing in crap, literally. Chickens, pigeons, starlings, birds, and bats. You really don't want to be digging in the dirt around, bird poop. This is what it basically comes down to. South Africa, pulmonary infections, cave disease. It's endemic in many parts of the world. It exists usually near rivers and high humidity, warm temperature regions. Lungs are believed the usual port of entry. 4 forms of it. Acute pulmonary histoplasmosis can either be asymptomatic or symptomatic. Display symptoms, no display symptoms, that sort of gig. Know the specific information for these. This would be important. Prognosis is usually good for acute pulmonary histoplasmosis. That would be a good takeaway. Chronic, progressive form of the previous one, causes inflammation, caseation, so caseatic necrosis and cavitation, starts killing and chewing holes through your flesh. Frequently, it's misdiagnosed as tuberculosis. Usually seen commonly in otherwise healthy males older than 40 years old, and if you happen to get this, it's pretty much down the drain, man. Occasionally, it spreads throughout the blood. Once you know it's in the blood and in the lymph, it starts killing everything, and you're just going to be miserable. Macrophages are stuff with organisms that resemble visceral, whatever those are. Jaundice, fever, leukopenia, anemia lead to a condition that mimics tuberculosis, which is why it gets confused for it. Acute disseminated histoplasmosis may be benign or progressive, very fatal, usually encountered in young children or immunocompromised adults. Tells you what affects spleen, lymph nodes, liver are enlarged. Bone marrow smears may reveal the organisms or granulomas. And chronic disseminated occurs in elderly and otherwise healthy individuals, may be fatal. Clinical features vary according to the organ most severely involved with. Other mycotic infection, it gives you a bunch of these, but there's tons of fungus out there, and only about 100 of these are actually pathogenic to humans. For the most part, the fungus happens as a result of some other primary infection. So why do we care? Opportunistic, they can jump if we don't take care of it. We can inhale it if it's in our lungs. Obviously, that's a problem. They produce lesions, so at least if we see the stuff, we should be even more on the guard. And obviously, don't be putting your nose next to any of the open areas where they might come out. If you notice lesions at all, you know that there's a problem and you should be on extra care duty here, making sure you don't stick yourself or inhale something you shouldn't. When playing and moving remains, don't compress the lungs or cause shifts in the viscera, which may cause the lungs to expel air to offset the pressures, because the spores can get expelled into the environment, which is when you inhale them. Spores can lay dormant forever, depending on the type of fungus, as you will learn in micro if you haven't already. And then you're going to inhale them. You might get them on another body, etc. You do not want to have to deal with it. It also says that, it can get on the stuff around the embalming room. So that would be important, that you do your terminal disinfection, you disinfect your surfaces like we do here in our own labs. Obviously, if you're playing with lesions, you should never play with bare hands. You might want to not just wear gloves, but you might also want to wear disposable sleeves. And if you have clothing that may have been compromised by a fungal organism, you definitely don't want to take it home with you. Take that off, throw it in the washer. Be careful. Be very careful. It says greater danger lies in the possibility that unsuspecting embalming personnel might inhale spores through cuts or breaks in the skin. Spores can enter the ventilation system and spread throughout the funeral home. That sounds even more delightful. Imagine that lawsuit. So it tells you what you should do, and this is nothing that should be new to you. Carefully dispose of personal garments. Put that in the biohazard. Don't keep the stuff lying around. If you do, wash it. All of this stuff is stuff that we practice because of universal precautions anyways. Folks, almost to the end of the journey here. Chin up.